6:25 on the clock, and we continue our back to school coverage here on Daybreak, getting you ready and informed on everything you need to know before your kids head back to school. We're going to talk about two important things: school vaccinations and sports physicals. Yes, it's time to get all those things done, and my guest this morning is here to talk more about that. Joining me is Dr. Leela Park from IU Health Arnett, a pediatrician. Thanks so much.
Good morning, Jamie.
So let's talk about vaccinations, because it is that time of year. What are the important ones for parents to have? What do they do, and why should they have them?
I think the most important vaccine for right now is the second varicella vaccine, or the chickenpox vaccine. The requirements are getting a second dose, and the reason why is the first dose we thought would be protective throughout your adult years, and obviously that's not protective, and so the second dose really ensures that protection through the adult years, because that's when you really want to prevent chickenpox because of the increased complications of chickenpox during that age, such as pneumonia or severe infections. So the second chickenpox is now required for school entrance.
Okay, so, and that's something very important. I remember having chickenpox as a child, and I had, if I remember correctly, even had the vaccine too. So want to make sure that we do our best to prevent that and prevent it from spreading. Let's also talk about sports physicals, because a lot of parents getting ready. It's almost fall, getting ready for that time of year.
The primary goal of a sports physical is really to ensure the safety of the student athlete as much as possible. And doing a sports physical, ideally 4 to 6 weeks before the sport, is really the ideal time.
Okay, why that amount of time?
You know, it gives us time. For example, if during the physical we find out that there is a family history of sudden cardiac death, or maybe we hear a heart murmur, we have the time to do some diagnostic testing, or maybe we identify some old musculoskeletal injuries. We have time to do some rehab work before the sport starts. So that's the ideal time. But obviously, there's a mad rush to get the sports physicals done, but we try to do the best job that we can in order to ensure, again, the safety of the athletes. We're trying to detect basically any kind of family history which may predispose a child to have sudden cardiac death. It's a rare but devastating event, and if we can try to get a good medical history from the parent and from the child, it seems to be the most sensitive way that we can try to identify those conditions.
So time being, of course, the important aspect to hit home and to hammer home this morning. And of course, we want to thank you for coming in and for sharing this. And parents, very important information. Get those physicals, get those vaccinations done as soon as possible to allow for lots of time for taking care of issues that may unfortunately pop up.
Right.
All right, Dr. Park, thanks so much for coming in and being my guest this morning.
Thank you, Jamie.
Appreciate it. Well, coming up at the bottom of the hour this morning,